Ron Paul and the Great Progressive Myth. America got a perfect exposition of the Great Progressivist Myth in the September 12th CNN Tea Party presidential debate. The Great Progressivist Myth is this: if government doesn't do it, then it won't happen. If the government doesn't do it, it doesn't count. If a person is against government intervening, you therefore must favor the ends that liberal or progressive claims will happen without government intervention. In short, the Great Progressivist Myth is that you either favor government intervention or you are an awful person who wants some horrible consequence. During that debate, Dr. Ron Paul, an obstetrician and Texas congressman, had the following exchange with moderator Wolf Blitzer.
You're a physician, Ron Paul, so you're a doctor. You know something about this subject. Let me ask you this hypothetical question. A healthy 30-year-old young man has a good job, makes a good living, but decides, you know what, I'm not going to spend $200 or $300 a month for health insurance because I'm healthy, I don't need it. But, you know, something terrible happens, all of a sudden he needs it. Who's going to pay for if he goes into a coma, for example? Who pays for that?
In a society that you accept welfareism and socialism, he expects the government to take care of
it. What do you want?
But what he should do is whatever he wants to do and assume responsibility for himself. My advice to him would have a major medical policy, but not before.
But he doesn't have that. He doesn't have it, and he needs intensive care for 6 months. Who pays?
That's what freedom is all about, taking your own risk. This whole idea that you have to prepare and take care of everybody.
But Congressman, are you saying the society should just let him die?
No.
Just let him die? Note the progressivist assumption by Blitzer that there is only one alternative to a man dying: government intervention. In the progressive mind, there is no alternative. But Ron Paul, who's old enough to remember an America before the welfare state took control of medicine, responded from his long and professional medical experience as a doctor.
I practiced medicine before we had Medicaid in the early 1960s when I got out of medical school. I practiced at Santa Rosa Hospital in San Antonio, and the churches took care of them. We never turned anybody away from the hospital, and we've given up on this whole concept that we might take care of ourselves, assume responsibility for ourselves, our neighbors, our friends, our churches would do it. This whole idea, that's the reason the cost is so high. The cost is so high, we cause a dump it on the government, becomes a bureaucracy, it becomes special interest, it kowtows to the insurance companies. And
Dr. Paul's brilliant response to Blitzer's ignorant question couldn't be described by any other word besides the internet neologism, total ponage. But to the progressive, of course, it doesn't matter how healthcare was handled before Medicaid. If government doesn't do it, it doesn't count. A prime example of this is New York Times columnist Paul Krugman's column on this exchange in the debate. Krugman's column, Free to Die, makes two important and false points. He wrote, quote, "Now there are two things you should know about the Blitzer-Paul exchange. The first is that after the crowd weighed in, Krugman first claims that the crowd weighed in, referring to a handful of cheers at the wrong time in the debate. These loud cheers appeared to answer yes to Blitzer's question, should society just let him die?"
But Congressman, are you saying the society should just let him die?
No.
But this was not the crowd. It was one loud person followed by a handful of possibly drunken spectators in an audience of 1,000. That's all it takes for a progressive to tar the entire Tea Party movement, of course. Left-wing groups have already assembled television advertisements based on that handful of cheers, such as this MoveOn.org commercial. Even people who have been fair to Ron Paul, such as Comedy Central's Jon Stewart and Stephen Colbert, stopped the tape roll of debate at the errant cheers and avoided Dr. Paul's informed response. It was a classic case of the progressive fallacy. If government doesn't do it, then it doesn't count. So why run Dr. Paul's response if it doesn't count? Krugman also made that point in his column, writing, quote, Dr. Paul basically tries to evade the question, asserting that warm-hearted donors and charitable individuals would always make sure that people received the care they needed, or at least they would if they hadn't been corrupted by the welfare state. Sorry, but that's a fantasy. Krugman is sure that American society is thoroughly corrupt and uncaring, and that not one person would step into the breach to help this man. In that sense, Krugman's accusation against America reminds me of Edmund Burke's quote, "He that accuses all mankind of corruption ought to remember that he is sure to convict only one." But Krugman says that only government can do many things. In 2002, he cheered on the housing bubble that caused our current recession, while Ron Paul warned against it. Consider Paul Krugman's view that the only way to prevent poor people from dying is for government to intervene. But government has a poor record of saving lives, while the one thing government has traditionally excelled at is taking lives. Indeed, while government healthcare inevitably involves rationing to limit costs and kills market development of innovative medicines wherever in the world socialized medicine has been installed, governments have been history's most prolific killers. Whether it be healthcare or terrorism prevention, the federal government is not the solution. It is the problem.